Thank you very much for joining us today. Let's give our colleagues a few minutes to join in, and then we can officially start our webinar today. Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining us from. My name is Michael Muthamia, a Senior Regional Program Advisor with JPIGO, and I'm the Country Program Manager for AMPLI PPHI Kenya. I'm a nurse midwife with over 18 years of experience implementing reproductive health programs across public and private sectors, and my expertise include technical leadership in design, implementation, monitoring, and scale-up of RAMCA interventions in low-resource settings. Over the past 6 years, I've focused my efforts in translating WHO recommendations on postpartum hemorrhage prevention and management into practice through such projects like AMPLI PPHI and Smiles for Mothers. It is my pleasure to be your co-moderator in today's session with Dr. Victor. Yeah, so today's webinar is on health systems approach to introducing PPH innovations, experiences, lessons from the AMPLI PPHI project. So thank you very much for joining us today. Before I begin, I'd like to share a few housekeeping issues. Today's session will run for approximately 90 minutes, including presentations, a panel discussion, and audience question and answers. We will start with 4 presentations, followed by a panel discussion. Please submit your questions through the session using the Q&A function at the bottom of your screen. If your questions are directed to a specific speaker, kindly indicate that. The webinar will be conducted in English with simultaneous interpretation in French. So please select your preferred language using the interpretation icon at the bottom of your screen. Again, closed captions are available. To enable that, select the Show Captions at the bottom of your screen and turn on translation and select your caption language. And if you cannot see that icon, please select the More box, and the 3 dots will guide you to show the captions from there. Yeah, so as you all know, postpartum hemorrhage remains the leading cause of maternal mortality globally, with disproportionate burden in low middle income countries. While effective interventions are available, these interventions have taken so long to reach where they're supposed to be. And for us to address this challenge, we need to have a health systems approach, as you can see on your screen, to make sure that these innovations are embedded within policy and guidelines. They're supported by appropriate financing mechanisms, backed by market readiness, including targeted capacity strengthening approaches, and also facilitated by reliable product availability through accurate quantification and supply planning. They also need to be integrated within the health information management system for us to have visibility of that, and also be driven by strong government leadership. So today's webinar focuses on that health system lens and what it truly takes to have those innovations in the supply chain and at the point of use. So this health system approach to introducing life-saving products is well illustrated in that image that you can see on your screen. It highlights not only the health system components that must be addressed, but also some strategic levers such as evidence generation, country leadership, partnerships, and equity, amongst others. So today, our distinguished panelists who have been part of the AMPLI PPHI journey will share their reflections and insights. They will highlight some of the key considerations, practical recommendations for catalyzing early adoption of these life-saving innovations. Without a strong health systems approach, such innovations take much longer to reach where they're supposed to be. Please allow me to introduce our first speaker, Ms. Elaine Roman, who works with JPIGO as the Global Project Director for Accelerating Measurable Progress, Leveraging Investment for Postpartum Hemorrhage Impact Project. And for the last 20 years, Elaine has worked with global stakeholders and partners across low-middle income countries to support efforts to advance and improve maternal and newborn outcomes. She has authored several publications on malaria in pregnancy and more recently on PPH. Elaine provides programmatic and technical support across 20 countries and more in Sub-Saharan Africa and East Asia. Today, she will ground us on this webinar in terms of the project, and she'll talk about how AMPLI PPHI project is contributing to this great initiative. Over to you, Elaine.
Thank you, Mike, and welcome to everyone wherever you are joining from. I am delighted to be here today for session 3 in our Amplify webinar series, and I hope you've had the chance to tune in to webinars 1 and 2. Up front, I want to thank our donor Unitaid, and with complimentary support from the European Union's Safe Birth Africa initiative, a joint Unitaid UNFPA venture and a global gateway flagship project. I also want to thank our government partners and ministries of health who have driven Amplify from the start, building on many years of country leadership to advance maternal health outcomes. And just like webinars 1 and 2, and as Mike said, I have a few slides up front just to ground us in the Amplify project. Amplify was launched on the heels of decades-long work, commitment, and progress across countries, and grounded in the research and global guidance that newer postpartum hemorrhage products will make a significant difference in maternal health outcomes. Across different contexts and at all levels of the health system, Amplify set out to support countries to catalyze the early adoption and scale up of these products to prevent, detect, and treat postpartum hemorrhage. We wanted to demonstrate in real-life settings that the products shown here can be used effectively when they are available and providers are supported and existing health systems are ready and equipped. The project launched in August 2022 in focused geographic areas of the Democratic Republic of Congo, Guinea, India, and Kenya, with Nigeria and Zambia joining in mid-2024. JPIGO's work, together with our partners FIGO and PATH, focused on 3 interconnected priorities: generating evidence that would inform scale-up, strengthening enabling environments so countries can sustain progress, and increasing the availability of affordable quality PPH commodities. This slide highlights the reach of the Amplify project across the 6 countries and in more than 200 health facilities. These products were introduced at different times over a period of about 30 months, and the picture is clear. Among the thousands of births across project sites, nearly all women received preventative care with heat-stable carbetocin. A calibrated drate was used to detect postpartum hemorrhage, and among women diagnosed with PPH, they were given tranexamic acid as part of the motive bundle. If you had the chance to participate in webinars 1 and 2, you know our webinar series brings together 4 years of learning, focusing on the practical approaches for introducing and integrating quality PPH products across different contexts and into existing maternal health systems so that countries can move from product introduction to scale up. While our first 2 webinars focused on Amplify's IJGO supplement and the provider experience respectively, today's webinar, as mentioned earlier, focuses on the health systems that must be ready to support implementation, continuity, and scale up. Please enjoy today, and I hope you are also able to register for our next webinar on June 30th, focusing on access to quality and affordable postpartum hemorrhage products. Thank you. And Mike, back to you.
Yeah, so thank you very much, Elaine, for setting the stage so well. It's now my pleasure to introduce Rachel Musimiko Muyoma, who will talk to us about sustainable product introduction as a key approach to ensuring that a health systems approach is being used to introduce these products. Yeah, so Rachel is a pharmacist, a public health supply chain specialist with over 15 years of experience strengthening health systems and improving access to essential medicines in Zambia. She has worked extensively with government and global health partners to enhance commodity security, forecasting and supply chain performance. Our focus is on building resilient health systems that ensure that these products are available in a timely manner, and making sure that these products are where they need to be. She's a 2017 Mandela Washington Fellow, a published author, a holder of postgraduate qualifications in supply chain management, leadership, among other qualifications. She's very passionate about capacity building and evidence-based health solutions. So Rachel will walk us through what sustainable product introduction looks like in real practice, and she'll also highlight some lessons from the Zambia's experience, including use of innovative financing models. Over to you, Rachel.
Thank you, Michael, and good day to everyone, and thank you for joining the webinar. Today, I will be discussing sustainable product introduction from a health system perspective. So while much attention is often given to the launch of the new health products, the real measure of success is whether those products remain available, affordable, and accessible to the patients who need them over the long term. So our discussion draws on practical experiences from the public health supply chains and highlights key considerations for ensuring that new products do not simply enter the system, but become sustainably integrated into routine service delivery. When we discuss sustainable product introduction, as outlined by Elaine, we are referring to more than simply adding a product to a treatment guideline or conducting a pilot project. A product is sustainably introduced when it is prioritized within the health system, financed through reliable funding mechanisms, procured through efficient processes, distributed through established supply chains, and routinely available to patients. So the ultimate objective is not the introduction itself, but continuous access. Too often, successful product launches fail to maintain availability due to inadequate consideration of financing, procurement, and supply chain issues from the outset of the introduction. So Many countries face similar challenges when introducing new health products. First, the products may be introduced without long-term financing strategy. So there is initial donor support covering early procurement, but sustainability becomes difficult once external funding ends. Second, inclusion in treatment guidelines does not automatically translate into procurement and availability of the product. Third, weak forecasting and limited demand visibility often lead to underestimation or overestimation of needs, leading to stockouts or overstocks. We also see fragmented procurement arrangements where governments, donors, and implementing partners procure separately, reducing efficiencies and bargaining power. Finally, supply interruptions frequently occur once the pilot projects are completed, leaving patients without continued access to the products that were introduced. So these challenges that are common in many countries demonstrate why product introduction must be approached from a health system perspective, health system intervention, rather than a standalone activity. The first step in that process is selecting and prioritizing the right products. We have to have the right products. So several factors should be considered. One, the public health need and disease burden, the evidence of clinical effectiveness and safety, affordability and value for money, quality assurance requirements for the products and in the system, and then the health system readiness to support the implementation. So the critical message here is that inclusion in national guidelines or essential medicines list is not enough. Products must be prioritized within the procurement plans, financing mechanisms, and supply chain systems. So for example, under the AMPLI PPHI, the products such as heat-stable carbetocin, tranexamic acid, misoprostol, and the calibrated drips were prioritized because they addressed major causes of maternal mortality while offering practical implementation advantages. Once the product has been selected, accurate quantification becomes essential. So successful forecasting relies on data on disease burden, service utilization, historical consumption, what has been used, and then the expected scale up. All of these are needed to estimate demand accurately. Equally important is assessing the budget impact, what that introduction will do to the budget. So introducing a product without understanding the financial implications can create future supply challenges. Then thirdly, supply plans should align anticipated demand, which are forecasted, with the resources that are available, as well as the procurement timelines and the lead time to have the products available. Then fourthly, risk management. I think it's not often emphasized how important risk management is, and it must be incorporated throughout the procurement and supply management cycle. So even from quantification, so potential risks such as supplier delays, funding gaps, regulatory challenges, or unexpected increases in demand should be identified early and mitigation plans developed. So strong forecasting and supply planning are among the most effective ways to reduce stockouts and minimize wastage in sustainable product introduction. The next consideration is procurement. Sustainable product introduction requires procurement strategies that will maximize value while ensuring the security in supply. And the procurement system needs to be efficient. Among the strategies that you can use are framework contracts, which help countries secure products over longer periods while reducing procurement lead times. You're not doing one-off tenders, you are actually doing call-off orders, and the time required for that is shorter. Then pooled procurement mechanisms also enable multiple countries or institutions to aggregate demand and negotiate better prices. Examples of these include regional procurement mechanisms such as the SADC, the African Union, East Africa, UN agency procurement platforms, as well as the Global Fund's WAMBO platform. Then strategic sourcing also arrangements to allow countries to diversify suppliers and strengthen supply resilience. So the objective is not simply obtaining the lowest price, but achieving the best value through affordability, quality, reliability of the suppliers, and supply continuity. Then a key principle in all of this is the integration of the products into the health system. New products should strengthen the existing systems that are there rather than create parallel systems. So what this integration means is you're introducing these products in the national supply planning processes, in the information systems that are used for reporting, ordering the medication, in your warehousing and distribution networks, health worker training programs, as well as monitoring and reporting frameworks. For example, in Zambia, the products introduced through the AMPLI PPHI initiative were incorporated into the existing national systems. They were stored at the Central Medical Store, ZAMSA, and distributed through and managed through the routine documentation and reporting mechanisms already in place. So this approach improves efficiency and increases the likelihood that products remain available after project support ends. Next, we sustain product availability through partnerships and resilience. Several strategies can strengthen long-term product availability. The pooled procurement is also a way of continuing partnership and regional collaboration, which can improve purchasing power and supply security. Match fund mechanisms, we're looking at reliable funding mechanisms. A good example of that is the UNFPA Compact, where matching government contributions enhance the purchasing power for reproductive health commodities. So the Zambian government progressively increases financial commitment to reproductive health commodities between 2023 and 2026, committing over $11 million between 2023 to 2025 and obtaining a match fund of 5.5 million US dollars from the UNFPA. So these mechanisms expand the resources available for commodity procurement and strengthen supply security. Domestic resource mobilization is key. Ring-fence allocations within the national budgets to ensure predictable financing. Sustainable product introduction requires transition from donor dependence toward increasing domestic ownership and financing. Finally, local and regional manufacturing reduces dependence on distant suppliers, shortens lead times, and improves supply resilience. In the AMPLI PPHI context, calibrated drapes sourced from regional or local manufacturers supported both the sustainability initiative as well as economic development. So what does success look like? What does it look like in a sustainably introduced product? The product is consistently available, it is affordable, it's reliably financed, it's integrated into routine operations, and it's resilient to funding and supply disruptions. Ultimately, the goal is not simply introducing a product. The goal is to ensure that every patient who needs that product can access it consistently, safely, and sustainably. Sustainable product introduction is therefore a continuous process involving prioritization, financing, procurement, supply chain integration, partnerships, and system strengthening. Thank you for your attention and handing it over back to Michael.
Yeah, so thank you very much, Rachel. The message is clear. Sustainable introduction of life-saving product goes beyond pilots. It requires a health system approach, which means it needs to be prioritized, needs to be financed, needs to be procured, and consistently available. Some of the key enablers include forecasting, efficient procurement, strong integration within the system. Thank you very much, Rachel, for those insights. Yeah, so please put your questions in the Q&A box for the presenters. We'll be able to respond to that at the end of the webinar. So please allow me to introduce our next speaker, Dr. Lois Nyanjao, who is a distinguished global health leader with over a decade experience in designing and implementing large-scale health programs, known for a strategic vision, transformative leadership. She has led health policy reforms, strengthened regional partnerships, and mobilized resources in alignment with national, regional, and global priorities. As the head of maternal health at the Kenya's Ministry of Health, she spearheads the national maternal health agenda in advancing high-impact interventions, improving care, and strengthening county-level coordination. She holds advanced degrees in medicine, public health, global health, national security strategy, and champions sustainable evidence health solutions across Africa. Over to you, Dr. Lois.
Thank you very much, Michael. Good evening, good morning, good afternoon, wherever you are. I'm very honored to share Kenya's journey in introducing PPH commodities and riding on the background that was shared by Elaine and the principles that my colleagues Rachel and Michael have shared. Kenya's journey is still work in progress, and I hope that we can all learn from each other from this case study. So I will start us off with just a very quick overview of how the health system in Kenya is structured. We have a devolved system of government in Kenya, and this means that services, especially in the health sector, are delivered mainly at the subnational unit, and the national government is essentially mandated to develop policy, oversight the implementation of this policy, build capacity of delivering quality services, and also mobilize resources. So I sit in the national level, and that is a mandate that I'm tasked with specifically for maternal health. Within the national government, we also have enabler agencies, and one of it being the Kenya Medical Supplies Authority, abbreviated KEMSA. This is an agency that is mandated to procure, warehouse, and distribute essential health commodities to support our subnational units in delivering health services. So within the Ministry of Health and within the division of reproductive, maternal, newborn, child and adolescent health, we have a mechanism that essentially leads the coordination of implementation of high impact interventions, specifically in the arena of commodity supply. And this mechanism, we abbreviate it as RAPTIS, but that stands for RAMCA Products, Technology, Innovation, Steering Committee. So this mechanism in our journey really led the efforts to put together the evidence from the AMPLI PPHI study that then enabled uptake of the study findings into policy and practice downstream. And the journey that Kenya walked to adopt the I would call them newer products for PPH, pretty much followed the cycle that was described earlier by Michael and Rachel. And we began by reviewing the evidence that existed through review of policy documents, as well as the new the findings that were coming from the AMPLI PPHI study. And thereafter, we convened stakeholders so that we could build consensus on what is it that Kenya wishes to adopt as our response to the high burden of PPH that we experienced. And from that consensus building engagement, we were able to identify bottlenecks within our system and where we would be able to intervene in order to enable the uptake of the PPH commodities, but also enable further research and information evidence generation from all the actors within the sector. We then sought to collaborate with partners to address these bottlenecks. And as Rachel highlighted, there are a number of facets with introduction of new products that you have to engage various actors along that supply chain security pathway. And so with our partner collaboration mechanism, we were able to, once we identified the bottlenecks, then devised ways of resolving these bottlenecks across the continuum of introducing the new products. And we also developed a costed implementation plan, which then guided how we would scale up, not just the adoption, but also the routine use of these products. And therefore, we were able to institutionalize all these processes by reviewing the essential medicines lists. We were able to update our national guidelines on managing obstetric complications. We were able to revise our training packages on EMONC. We were able to engage our colleagues in the pre-service arena to update their training materials for the medical colleges and the universities, and so on. And along that journey, we then sought to establish how this product, once it is adopted and introduced in the country, how would we ensure that we sustain the availability and the use? And so with the quantification report that had been developed, we're able to advocate to the various quarters, including the Medical Supplies Agency, to update its procurement catalog so that it then onboards these new products, which span from heat-stable cobetocin, the NASG calibrated drapes, the free flow uterine balloon tamponade, among others, so that our subnational units are able to order and draw down from the main supply agency. We're able also to advocate to the executive and the political classes that we would need to allocate more resources towards procurement of this product, and that therefore further strengthened the sustainability element of these products. Along the same breath, we were able to, for heat-stable carbetocin, we were able to negotiate with the manufacturer to reduce the price of the commodity to a price point that our subnational units would be able to procure, and that price reduction further enhanced the demand for this product amongst our subnational units, which were the service areas. We also strengthened the capacity of the users, the frontline users, through webinars, by updating the training packages and various other fora, including conferences, to generate that demand for the use of these new and effective commodities. With all those efforts, we were able to increase the uptake of products like, for example, heat-stable carbetocin through procurement by the main supplies agency, and then draw down by the subnational units, and that's something that is growing day by day. So the constant implementation plan has been a very useful resource for Kenya to inform and to enable resource mobilization, both domestic and externally. And to date, this constant implementation plan has informed further investment both locally and also from development partners for these life-saving commodities for PPH. For example, currently we're implementing a rapid results initiative as part of the Every Woman, Every Newborn, Everywhere acceleration plan that was just kicked off last month. And in this RRI, we have commitment from our government to procure additional stocks for heat-stable carbetocin and calibrated grapes, and we are now mobilizing further support from our development partners to invest in these life-saving commodities for PPH, because we have been able to demonstrate the effectiveness in addressing the burden for PPH in the country. So how do we intend to sustain the momentum beyond the project? As I mentioned earlier, we have adopted all these interventions for addressing PPH, which is essentially the emotive fast response bundle, into the Ewene acceleration plan. And by institutionalizing these interventions, we have then been able to mobilize political will from the highest office. Our president is the #1 champion for Every Woman, Every Newborn, Everywhere campaign. And because of this political will and the commitments made by government, we have really built up confidence of all actors within the health sector to adopt and mobilize, use and generate demand for this product at the very last or the very lowest level of service delivery. Further, we have been able to hold national webinars, including with our leaders of the subnational units. We call them governors. So we have been able to have advocacy forums with the governors, who then now understand what the value of these products and are able to put investments from the subnational level to make sure that these products are available. So essentially, the journey of implementing, of learning from the AMPLI PPHI project has seen Kenya be able to, by this time, we have been able to procure upwards of 800,000 doses of heat-stable carbetocin. We have been able to train, actually by now, 5,000 plus healthcare providers on managing obstetric emergencies. We have been able to engage the pre-service training institution lecturers to update them on the new technologies. We have been able to ensure that these commodities are available across the country. Heat-stable carbetocin, the NASG, the calibrated grapes, caffeine citrate, and that momentum is sustained, and we are very hopeful that the story of PPH in Kenya will be changing in the next few months. So the partnership with the project has been extremely valuable, because we have been able to generate evidence, and that evidence has informed change of policy and practice, and the journey that we have walked with all the partners who have been involved has been fulfilling and continues to yield more information as we continue implementing our Ewene acceleration plan. Thank you very much. Back to you, Michael.
Yeah, so thank you very much, Dr. Lois. Indeed, the Kenya's experience shows that scaling life-saving PPH innovations requires more than products. It demands strong government leadership, coordination among partners, and also deliberate integration into health systems. We also need to update the policies and guidelines, ensuring that we have the quantified products, we finance them, and making sure that we move together as implement partners and also the government. So thank you very much for those insights. I encourage you to please put your questions in the question and answer box as we continue having these conversations. So our next speaker is Professor Aisha Namu Adamu, who is a consultant obstetrician and gynecologist at Federal Medical Center in Kebbi. She's a distinguished educator involved in training, mentorship of resident doctors and future specialists in obstetrics and gynecology. She currently serves as the Assistant Secretary General of the Society of Gynecology and Obstetrics of Nigeria, that is SOGON, and she's also the national champion for AMPLI PPHI in partnership with FIGO. Professor Aisha will share with us SOGON's role, highlighting how professional associations can drive scale-up and sustainability, and also offer insights from Nigeria's experience on this journey. Over to you, Prof.
Thank you very much, Michael, for that introduction. Thank you, Lois, for your presentation from Kenya. We've learned a lot from your experience, from what I've heard. So I'm going to continue the discussion on postpartum hemorrhage by looking at the contribution of professional associations as catalysts for PPH prevention, detection, and treatment. We are going to look at how we're able to do it in Nigeria through the lens of Society for Gynecology and Obstetrics Nigeria. So just, I know we've talked about we've heard about PPH, but just to put it in context for us in low resource countries, why does it matter that we are talking about it? Why does it matter that there's so much interest in it? And this is because PPH is one of the leading causes of maternal death in low resource countries. And of course, we know that Nigeria is one. It's quoted that 1 mother in every 6 weeks dies from complication of postpartum hemorrhage. So the clock is ticking. But the good thing is that there are already proven interventions that when instituted very well in facilities, we tend to bring a reduction in the number of cases of postpartum hemorrhage and also in the severity in those cases they were not able to prevent. So there are proven strategies to prevent postpartum hemorrhage and also to treat it. However, there's a gap in delivery. So we want to make it routine care, but there's a gap in that, and that's the challenge. And that's where SOGON, as the custodian of women's health in Nigeria, that's where it comes in, as well as other professional bodies that are also concerned with maternal health. So SOGON is Society of Gynecology and Obstetrics of Nigeria, is a professional association and also a member of the AMPLI PPHI consortium. The role of SOGON as a professional association is actually to advocate for women's health issues, especially maternal health, to set standards as a professional body charged with looking after pregnant women, and also to ensure sustainability by contributing to training and using the accountability framework to follow up on what we do. But today I'm going to concentrate on advocacy as one of the roles that SOGON plays. So why our focus on advocacy? Why is it essential? Yes, we may have commodities. We have pushed to get commodities. We can push to get commodities on our shelves. We can push to get health workers trained. But our commodities and training alone would not do the job for us. We'll need to advocate to other key stakeholders, the policymakers and the financiers of health. We need to advocate to them to support all of these interventions. And so we want the government to actually endorse the available evidence. The WHO has shown that these interventions work well, and but the government needs to endorse it so that all care providers speak one voice and we use the same standard to manage our cases. We need to also unlock financing. You cannot sustain any intervention except it's very well financed. So we need to move. It's not just a one-off, donation. We need to keep it on the table all the time. And by doing this, in order to be able to do this, we need to get PPH commodities on the budget. So that's one area of advocacy. Then build ownership for the whole process, because donors may leave, but PPH will remain, and therefore we need a system that would outlast the contribution of donors. So we need to set the agenda for PPH and keep it visible to all leaders at every level. So how did we do it in SOGON? SOGON is a society, as a society, the members are clinicians. So the first thing we needed to do was to equip ourselves with the skill to advocate. So as partners in the consortium, with the role of advocacy, we went through a series of trainings to build skills on advocacy. And from there, we planned together with other stakeholders, the Federal Ministry of Health, and JAPIGO, we came together to map out who are those stakeholders that we need to get to, who are those that we need to advocate to. So we did that, and also put together the message. What message are we going to carry to them? So we needed to develop advocacy tools for that. And then to find a platform that will make our action accountable. So we joined forces with MPDSR at the state level and also at the national level to make sure that all gaps in PPH care are identified and strategies to bring them up brought forward. Then, of course, we also needed to advocate to everybody that's mattered on the need to take ownership, because as donors withdraw from this, we need to be able to sustain the whole process. We want to see our figures in postpartum hemorrhage drop. Okay, so yeah, so what did we do on the field? What message actually did we carry? First and foremost, to the government, we made sure we brought PPH on the agenda as a complication that is actually preventable, and that tools are actually available to achieve this prevention. We know the WHO has tested these strategies, and we found it useful. So that was one key message that we took to the government. To those who are in charge of financing the whole process, the message was that we needed a budget line for drips, a budget line for heat-stable carbetocin and tranexamic acid, and to know that a budget line for these commodities is actually a budget line for mothers' lives. And we needed to keep this on the picture so that we are all on it together. To the clinicians and care providers, we needed to get them to accept the new interventions that WHO has recommended. So we needed to get them to accept this to make it their everyday practice. So to train their trainees and also to change their practice if there was a need for that. But we needed to speak and use the same strategy in preventing postpartum hemorrhage. So we advocated to them on the new WHO approach to managing that. Or to everybody, there was a need to take ownership, and that we said should start today and not when the project is actually rounding up. The pictures you see there are the advocacy groups. One was in Kebbi State, where we met with together with our partners, JAPIGO, we met with the state government, and the one below is with the key government officials in Ogun State. These were the two states where the AMPLI PPHI project was implemented. So what changed? What was the result of our intervention? We were able to get PPH on the agenda. We were able to get people to hear about PPH, know about the commodities available. We made noise about heat-stable carbetocin, tranexamic acid, calibrated drips, and we're able to bring it to the picture so that we got government buy-in in ensuring that these things would be made available in a sustainable manner, even after the project had wound up. So states were willing to put their money in it. In Kebbi, we're able to get the state government to make its own arrangement to get calibrated drips with local manufacturers. At the national level, there was support from national that local manufacturers of drips should be supported, and therefore state governments should work with them to make sure that we are able to get this commodity at affordable prices. In Ogun State, it went beyond just advocating to politicians. We got the wife of the state governor to be an ambassador, PPH ambassador, and this ensured that whatever the government had committed to, there will be somebody there to follow up to see that they live up to their commitment. Accountability that works. We use the MPDSR, that is mater, perinatal, death surveillance and response committees. We're part of that, and because we are at the meetings, we're able to identify gaps, and we also discuss how to bridge these gaps together with other professional associations like Nigeria Association of Nurses and Midwives. We're able to set a standard of care that was shared across all healthcare providers, and this was by adopting the WHO PPH guideline. So the Federal Ministry of Health has, together with SOGON, we worked together to review and adapt what was suitable to us and our own context. from the WHO recommendation on PPH prevention and treatment. So there's actually a path to scale and a position to move from donor support to domestic ownership. Of course, there are challenges. You have challenges when you're introducing something new, even though the products are not actually new, but the approach is not something that is known to all, and that's what we want everybody to accept as the new approach to preventing postpartum hemorrhage. So there are challenges with computing priorities and tight budgets at the state level. But framing PPH within multi-cause maternal mortality wings, we're able to get the support of government to commit to that. Challenges with leadership and political turnover. Somebody commits to it and then he moves on, and then you have to start all over again. So to avoid this, we're able to engage institutions and technical working groups so that even after individual politicians have moved on, you have continuity of the project and ownership at the state level. Challenge with risk of donor dependency, and how do we manage that? We build domestic procurement and ownership into the whole process right from the beginning. Frontline buy-in, paired advocacy with NPDSR accountability, and professional association-led mentoring to reach providers and not just the policymakers. So we participated in training and retraining of our healthcare providers to get them in tune with what WHO has recommended. So it's good to know that if you want to replicate this in your respective countries, it's very easy to do that, but there are some take-home messages that you should be aware of. And that is, you need to lead with credibility. Your professional association has to be trusted and should be neutral. It should have a clinical voice, but neutral, should not participate in politics so that the politicians feel safe dealing with you. And then right from the beginning, you need to identify who your partners are. We worked with the JAPIGO and the Federal Ministry of Health, and that worked well for us. It opened doors for us, and you need to identify your partners that will assist you in achieving your mandates. You need to be specific with your message. Name the commodity, know the budget line you're pushing, and then what guideline you choose to push, and stick to that, because there has to be uniformity in what you do so that the message is clear to all. Build accountability. If you have an NPDSR in your country, use that. If you don't have that, know that clinical audits help in tracking your activities and making advocacy honest and visible. Design an exit right from the beginning. There has to be a pathway for exit right from day one, so that when the donors leave, there's ownership by your respective governments. And when you do this, partnership would outlast the projects. Amplify will close up and wind down and move, but PPH will remain. And as long as you have established a system working with other stakeholders, your impact through advocacy will remain, and there will be a sustained system that will continue to advocate for prevention and treatment of postpartum hemorrhage in your respective countries. I thank very much our partners, JAPIGO, the states, the governments, and Kebbi and Ondo states. Federal Ministry of Health has been very supportive, and then our other associations, National Association of Nigerian Nurses and Midwives, Pharmaceutical Society of Nigeria. I thank you all. Thank you for your time. I'll take your questions if you have any, while I hand over to Michael. Mike, over to you. Thank you.
Yeah, so thank you very much, Professor Aisha, for being a great champion of these life-saving products. I think the message is clear. Professional associations are critical catalysts for translating evidence into sustained practice. Through advocacy, standard setting, and partnerships, they bridge the gap between proven interventions and routine care. So thank you very much for your insights. We'll now be transitioning to the next part of our webinar. We will shift to hearing experiences from DRC and India. And this part of the webinar will be moderated by Dr. Victor Adepoju, who is a public health physician and implementation scientist serving as the country program manager for AMPLI PPHI project in Nigeria. He leads efforts to strengthen PPH prevention and management through evidence-based innovations, provider capacity building, health system strengthening, and he has over 15 years of experience in global health. He has supported large-scale programs in maternal and newborn health, as well as infectious diseases, and supports implementation research across Africa. So over to you, Dr. Victor, for this part of the webinar.
Thank you so much, Michael. We're now in the panel section of the webinar. I want to hear experiences from India and DRC. To start with, I would like to introduce Dr. Archana Mishra from India, who is the Senior Joint Director for Maternal Health, National Health Mission, the government of Madhya Pradesh in India. You can see we have a short biography in the slide that is being currently projected. So I would like to proceed with the specific questions and request her to share her experience of AMPLI, another maternal health innovation in India. So welcome, Dr. Archana. My first question is, based on your experience in Madhya Pradesh and the Amplify project, what key evidence, policy decisions, stakeholder actions have enabled Indian transition to PPH innovations such as stable carboxyl, calibrated drapes, and the WHO first response bundle from pilot to states to scale up? And what major barriers still hinder wider adoption in India? Over to you, Dr. Archana.
A very good evening to all the distinguished
We cannot hear you,
speakers.
Dr.
And
Archana. Okay.
can you hear me now?
Yes, we can. Please proceed.
Okay. Right.
A very good evening to all the speakers and the distinguished listeners who are participating in this webinar. The question is very specific, and I would like to share the experience of Madhya Pradesh, which is a state of India. It's a large state in India. It's a population of nearly 80 million, and we have annual delivery of around 20 lakhs, means 2 million. And we started Amplify PPHI project with technical support of Japaigo in two of our districts, and we gave consent for the pilot because it's a state where maternal mortality is high as compared to national average, and we are trying our level best, and there is a strong political commitment in reducing maternal and newborn deaths. So this pilot was actually addressing the public health challenge of addressing high MMR and PPH being the leading cause of maternal death. We went along with this project, and the focus was on giving heat stable carbetocin, because India is a country where the temperature goes up to 45 degrees to 48 degrees in summer. So heat stable carbetocin was the drug of choice in the three districts where pilot was done, and we gave this drug for AMTSL in nearly 65,000 women after delivery. Along with it, for the management of PPH, injection tranexamic acid was given, and in the pockets where home deliveries were high, these women were followed, giving advanced distribution of tablet misoprostol through our link workers, that is called ASHA. And actually, the major enablers which led to the success of this pilot, which is still ongoing, is the good technical support in capacity building and the robust supply chain mechanism. I would like to share with all of you that in our state, the government has already taken up tranexamic acid and misoprostol in essential drug list. So it is the pilot was aligned with government's policy and essential drug list, and we had inbuilt this program of emotive in our existing training guidelines. So we are training our doctors also and nurses also for the use of PPH bundle approach, so as to address mortality and morbidity because of PPH. But one thing which Victor has asked me, what were the constraints? So we need to actually, a lot of focus is required on maintaining supply chain and also in capacity building. And whenever a pilot is taken, robust record keeping and reporting is required. So we have tried to inbuild this reporting and recording mechanism in our existing technological platform, which is called as Unmol and RCH portal. We have not developed any parallel system, so that in the long run it will be helpful. So being subject of public health importance, I believe that this project and pilot was useful, and except for injection carbetocin, which our national government is yet in discussion uh, how to go along with that. The other interventions, we are very much aligned and we are taking it forward. Thank you so much.
So thank you very much, Dr. Achana, for that insight. My next question has to do with the requirements for responsible scale and sustainability. So we want to hear from you from the perspective of India. What are the requirements for responsible scale and sustainability? So when the maternal health innovation proves effective at pilot level, what core system requirements are needed to scale and sustain it across a complex ecosystem like that of India? Do you get the question?
I got the question.
Over to you.
Like,
If you can respond to it in just 2 minutes. Thank you.
Yeah. India is a large country, but the Indian government and the state government is very clear. They are working very hard towards safe motherhood and child survival, and we adopt all evidence-based strategies in reducing maternal and newborn deaths, and so there is no challenge as far as the political commitment is concerned, and we adopt evidence-based practices. Only thing for the any this upscaling of the pilot, the government ownership is there, and as earlier also I shared with you that supply chain mechanism is there. We have a tender mechanism. We go by rate contract, and there is a decentralized procurement of drugs. So procurement of drugs and reaching the drug to the last mile is challenge sometimes, for which we have to do a lot of monitoring and the capacity building of service providers, because advanced distribution of misoprostol is being done by our link worker, and the woman herself is consuming it after home delivery. So that requires a lot of follow-up and capacity building, so that there is no misuse of the drug. And as I already told with you that initially we had developed some registers, but now we have aligned with our existing recording and reporting mechanism. So as far as our state is concerned, I don't think it's a challenging task to upscale the pilot.
Thank you so much for your insight, Dr. Achana. From what you have said, Indian experience shows that successful scale-up of maternal health innovation depends on strong evidence, government ownership, policy alignment, sustainable financing, workforce capacity, as well as reliable supply chains and multi-stakeholder partnership. And to achieve that impact, like you have mentioned, innovation must be integrated into routine health systems, and that must be supported by accountability mechanisms and implemented with equity as the focus. So please, our participant, place your questions for Dr. Achana in the Q&A box. We will now transition to Dr. Chanta Lusekina from DRC, who is the head of the Family Health and Specialized Care Division at the Ministry of Public Health in Democratic Republic of Congo. We have a short biography in the slide that is being currently projected for Dr. Chanta. A reminder to please use the interpretation services and captioning services available to you by clicking on the respective icons in the bottom of your Zoom window, because Dr. Chanta will be speaking in French. Welcome, Dr. Chanta. My first question for you is that, how has the Democratic Republic of Congo introduced PPH products and intervention through a health system approach? And what are the key lessons that have emerged, particularly regarding the role of community engagement, integrating this innovation into the health systems? Over to you, Dr. Chanta.
Merci beaucoup, merci pour cette question importante. Je pense que vous m'entendez, hein? Merci. Nous notons qu'en RDC, l'introduction des interventions de prévention et de prise en charge des hémorragies de postpartum s'est faite à travers le projet que nous appelons le projet AMPLI PPHI, qui est une approche globale de renforcement des systèmes de santé mise en œuvre de 2023 à 2026 dans les 2 ans de santé couvrant environ 700 000 habitants au niveau du pays. Alors, le point de départ était bien clair. C'est l'HPP qui demeure chez nous une des principales causes de mortalité maternelle. Et à cela s'ajoute des défis systémiques, notamment, nous avions une capacité limitée de la chaîne de froid pour la conservation de l'ocytocine. Nous avions au même moment des ruptures fréquentes de stock de médicaments essentiels. Il y a une insuffisance également de prestataires dans leurs compétences, dans l'exercice de leurs compétences. Alors, pour répondre à ces défis, le projet a introduit la première réponse de l'OMS face aux hémorragies de postpartum et inutiles. Le projet a adopté dès le départ une approche systémique en étroite collaboration avec le ministère de la Santé, les autorités provinciales et locales, les partenaires techniques et les cadres de coordination existants. Alors, les interventions ont été alignées sur des politiques nationales, discutées dans le groupe technique intégré dans les services de routine. Sur ces, une leçon majeure concerne l'engagement communautaire qui est considéré comme un pilier du système. Cela a été déterminant pour l'acceptation du misoprostol que nous avons utilisé en stratégie avancée grâce à une sensibilisation adaptée et à la prise en compte des préoccupations locales. Alors, pour l'avenir, le projet soutient la transition vers le passage à l'échelle à travers l'intégration dans le système national, l'amélioration de la planification et des approvisionnements, le renforcement du suivi, de la coordination et du plaidoyer pour un financement global. Toutefois, les défis persistent au niveau pays, notamment le financement à long terme, la fragmentation des chaînes d'approvisionnement et le risque de rupture après le projet. Ça, c'est un grand problème. Et en conclusion, nous pensons que l'expérience nous montre que la réussite repose sur une approche globale combinant d'abord le leadership, le renforcement des capacités, la sécurisation des approvisionnements et l'engagement communautaire. Si tout cela est réuni, nous pensons vraiment arriver à un résultat positif. Je pense que je vous remercie pour votre question. Merci beaucoup.
Thank you, Dr. Chanta, for that insight. So my next question is that as the AMPLIFY project is concluding with very interesting results, so what is the country's priorities and strategies for sustaining and scaling the PPH innovation within the national health system? Over to you, Dr. Chanta.
Merci beaucoup pour cette deuxième question qui me paraît aussi très importante. Alors, nous disons que alors que notre projet AMPLI PPHI arrive à son terme, parce que nous sommes en 2026, avec des résultats très encourageants que nous en avons, je pense qu'on va vous les partager. La RDC se concentre désormais sur la durabilité des acquis et le passage à l'échelle des innovations introduites pour la prévention et la prise en charge des HPP. Nous notons en premier lieu une première priorité c'est de consolider les interventions qui ont déjà démontré leur faisabilité, leur acceptabilité et leur efficacité. Alors, le résultat obtenu aujourd'hui sur une base solide de données probantes pour soutenir les stations est là et on va vous le démontrer. La deuxième priorité concerne l'intégration complète de ces innovations dans les politiques, normes et protocoles nationaux. L'objectif est bien clair. Faire en sorte que la carbétocine thermostable, le misoprostol, les champs calibrés et l'acide tranexamique deviennent des composantes routinières du service de santé maternelle et non plus des interventions liées à un projet. Ça, pour la deuxième priorité. Et la troisième priorité, c'est de renforcer la disponibilité de produits qui est un exercice de avec un exercice de quantification des besoins et un plan national de passage à échelle, et ces là sont en cours. Il y a aussi le renforcement des capacités des prestataires qui est également essentiel pour nous au niveau pays, parce qu'il faut que les prestataires aient une grande compétence. Il faut par ailleurs qu'il y ait l'engagement communautaire qui continuera de jouer un rôle central au niveau pays, toujours. Et en parallèle à cela, le pays s'emploie à renforcer le mécanisme de suivi, de coordination et de redevabilité en insérant une coordination étroite entre les niveaux national, provincial et local. Toutefois, les défis persistent. Alors, notamment les financements à long terme, la dépendance aux partenaires extérieurs ainsi que certaines faiblesses dans les systèmes d'approvisionnement et de coordination. Alors, face à cela, les plaidoyers et la mobilisation des ressources restent vraiment essentiels. En conclusion, la stratégie de la RDC repose sur l'appropriation nationale, l'intégration dans le système de santé, le renforcement des capacités, la sécurisation des intrants, l'engagement communautaire et une coordination qui doit être renforcée. Alors, ces éléments indispensables pour garantir un impact durable et sauvegarder des vies maternelles sont d'une grande importance. J'ai dit et je vous remercie.
Thank you very much for your insight, Dr. Chanta. From your responses, you have highlighted that DRC introduced PPH innovations through Amplify using a health system approach aligned with national policies and implemented with governments, the provincial and local structures. Key interventions also include the coaching limitations, and you address that, medicine stockouts, provider skill gaps, especially for misoprostol, which you all addressed. For sustainability and scale-up, Democratic Republic of Congo is also prioritizing national ownership and integration into policies and protocols, provider capacity building and product availability with strong monitoring and coordination and resource mobilization. You also highlighted some few challenges, which include longer-term financing and the dependency on partner and some of the little weaknesses in the supply chain and coordination system. So thank you very much for those insights. So it is not too late to insert your questions for Dr. Chanta, Dr. Achana as well, or any of the previous speakers and you can do that in the Q&A session. Please go ahead and type your questions in the Q&A chat. So now we are in the Q&A session, and we now open the floor for responses to the audience. I can see that there is a question in the chat, and thank you, Dr. Lois, for addressing that question from the Kenya perspective. But I also want to give two of our speakers the opportunity to also respond to the question. And the question is that, based on the experiences from Kenya and other participating countries, what strategies have been most effective in ensuring continuous availability of essential PPH commodities and maintaining healthcare worker compliance with PPH guidelines after the initial implementation phase? So I want to divide that question into two parts. One is asking about our strategies to ensure continuous availability of essential PPH commodities. And I would like Rachel to address that in 2 minutes, while the second part is asking about how we ensure healthcare worker compliance with PPH guidelines after the initial implementation. Dr. Aisha can wait after Rachel to also answer that part of healthcare worker compliance. So over to you, Rachel, to share your thoughts on how we ensure continuous availability of essential PPH commodity. Over.
Thank you for that question. And part of that answer lies in, I think, that graphic that was showed at the beginning by Michael, the pathway of access, which outlines all the different system areas that need to be addressed to ensure that there's continuous availability. A key one, of course, is ensuring that there's long-term reliable financing. So it's important that there's domestic resource mobilization or ring fencing of funds for that. Where the products are in the guidelines, they are quantified, they need to be prioritized in the procurement plan. So those products need to appear in the procurement plan, and then there should be an efficient procurement mechanism in place that brings the commodity, that allows you to procure the commodity. So some of the strategies, we're having those framework contracts, for example, with the manufacturers, which are long-term, where you can call off orders and you know the lead time that the products will take for you to make them available. Then secondly, you need to have a good information system and through your distribution mechanism where you are able to respond to the needs from the facilities for the commodities that you have, where facilities are able to order and you're able to deliver the products in time. So it's a whole, as we've tagged this webinar, a whole system approach to availability. You need to have all the aspects, the distribution aspect, the forecasting aspect, the financing aspect, the regulatory aspect, the quality assurance aspect. All of those have to be working and strengthened for us to have continuous availability of the PPH commodities.
Thank you so much, Rachel, for that excellent response. So I will now come to Professor Aisha to give some additional insight, especially to the second part of the question. As a professional association, I know Shogun, this is Society for Gynecology and Obstetrics of Nigeria, is much more involved in assuring provider compliance, adherence to guidelines, and all that. So, Professor Aisha, what are the strategies that have been more effective in ensuring healthcare workers maintain compliance with PPH guidelines after the initial phase of implementation? Over to you, Professor Aisha.
Yeah, thank you very much, Victor, for that question. And yes, I would say very simple, in the sense that, as a professional body and as a body of care providers, we are on the field all the time. We're in the hospitals, we're by the bedside, we're in the clinics, we're in the labor wards. So the most important thing, I think, as a professional association, you have to think about, first of all, getting the standard to be accepted by you, even your own members, by your colleagues. They have to accept it as the only standard for everybody to practice with. That's very key, right from the word go. And once they accept that, then the next thing is, they will have trainees with them. They have people that they are mentoring, is to get them to also, practice this every day so that it becomes an everyday practice. It becomes routine practice. So there was a lot of training and retraining and mentoring, active mentorship to all the different healthcare facilities at the different levels. And then at the tertiary levels, engaging the residents to understand what is the new approach to managing postpartum hemorrhage. So I think a lot of clinical work itself, doing it, putting it into practice, and then mentoring people with the teaching, and then getting people to accept it as the only strategy or the best strategy, maybe not the only, but the best strategy to approach PPH prevention and treatment. So yeah, professional bodies. And we were able to do this not just for us as doctors. We work together with the midwives, and that is very important. Partnership is very important. Identify all the key drivers, all those people who are stakeholders in care provision, and work with them. So we worked with the nurses and midwives. We did the trainings together, and the mentoring we also did together. And of course, we work together in our labor wards. So that is very important. Partnership, partner with the right professional body, and work together as a team. And I think that is, from the clinical point of view, that is a very useful strategy, and that worked for us. Yes.
Thank you, Professor Aisha, for that excellent and great insight. I think I will just want to ask one more question to Dr. Lois, if you don't mind. Let me come back to you. And my question for you is that I know you've mentioned a couple of instruments to mobilize resources, you've mentioned framework contracts, and so many other ones, matching fund. So which approach really increased domestic financing, put procurement mechanism, is it framework contracts or local manufacturing, has the greatest potential among all of them to improve the long-term sustainability of products introduction in low and middle income country? Over to you, Richard.
Well, thank you for that question. In terms of long-term sustainability, it's domestic resource mobilization is key. You never know how a donor landscape may change from year to year. So, and I'm glad Prof also talked about the role of the professional organizations in terms of advocacy to the politicians that and government heads in terms of allocations of the budgets, ring fencing, financing, and ensuring that money is routinely allocated to these major health needs. When it becomes a government priority to save lives of mothers and advocate to save our mothers' lives, this is the funding that we need to ensure that the products are consistently available. I think that actually goes a long way, so that when partners and donors come in, it's implementing efforts and taking you further. So most sustainable is as much as possible advocate and have domestic resources put on the table and ring fenced to ensure that the vital life-saving commodities are procured.
Thank you very much, Richard, and thanks to all our panelists as well as participants for your engagement. As we bring this discussion to a close, a few reflections stand out. First, is that achieving sustainable impact in postpartum hemorrhage is not just about isolated intervention. It actually requires deliberate alignment across the entire health systems. Second, we've learned today that progress depends on addressing policy, on addressing financing, and data as well as governance at the same time, not in silos. Third, we have also learned that strong partnerships and professional leadership remains very critical to both scaling and sustaining these efforts. And fourth, we've also learned that meaningful engagement of end users is a core component of a health system approach to introducing and sustaining innovation. And finally, we have heard from our speakers that planning for sustainability and domestic ownership must begin from the outset, not at the end of the project. So these are the foundations that we must carry innovation from pilots to lasting impact. Thank you all for your insight and your leadership. And now I will hand over to Mike. Over to you to close the webinar, Mike.
Yeah, so thank you very much, Dr. Victor, and thank you very much to all our speakers and participants. It's been a very engaging webinar. I know everyone in this webinar today is an agent of change. You can make a difference in making sure that these life-saving innovations get to every maternity in the areas you work. And we encourage you to do 3 things. One, think about a health system action that you will prioritize to introduce and scale up PPH products and innovation. Just one health system action that you'll take as an agent of change. Number 2, as you heard from this webinar, coordination is very critical. Think about how you'll be able to coordinate partners, stakeholders to address the issue of introducing these products to every maternity. And then the other item that I want you to think about is one policy and financing lever that you will explore in the next 6 months. Think about it. What can I do as an agent of change to drive financing or policy change for these innovations? Because we need to save our mothers and save them now. Yeah, so a link to the registration link of our 4th and last webinar will be provided in the chat in a few minutes. So please make sure that you join this webinar. The webinar will happen on 30th and we'll be discussing catalyzing systemic changes to improve availability and affordability of PPH products. We'd love to have you in this last webinar so that we can be able to share our insights on these. This and the previous webinar series has been recorded and will be made available in the AMPLI PPHI online repository, which will be shared with you as another key project resources. So please you'll be able to get that link so that you can be able to see some of the key resources that we've put together. We will also take this opportunity to promote the AMPLI PPHI supplement, which was published in the International Journal of Gynecology and Obstetrics. Please be sure to click the link or even scan the QR code that you can see on your screen for you to be able to explore the several publications that are there. So thank you very much. We greatly appreciate your time, and we thank you very much for joining this conversation. Thank you. You are free to leave the webinar.